Hi ladies, welcome back. So today is a back strengthen and release class to help sort of relieve any sort of lower back discomfort, which is really common in pregnancy, especially sort of beyond that sort of 18-week mark. So we want to sort of get to the root of the cause, which is we've got this change center of gravity, we've got this extra mass that we're dealing with, and we can't necessarily change that too much, but what we can do is learn to sort of really use our core muscles when we are loading the body in any way, and just to be more conscious in the way that we move from that place of stability. So a block is helpful, and if you don't have a block, you can use a book or a chi ball and a band. If you don't have like a booty band, just tie a normal TheraBand in a loop. So we'll come first of all into some stabilizing work. Grab your block, pop it between your upper inner thighs. I do prefer a rubber block. The cork block is a little heavy. So we will have the rubber blocks available on our site soon. So come into a sort of recumbent position for a bridge. My fingers are facing towards my body, shoulder blades draw back. Take an inhale here. And as you exhale, squeeze gently with the block as you lift up through the pelvic floor. So no gross movement just yet. Inhale, let the block soften. Exhale, gently squeeze the block, lift up through the pelvic floor, and then we'll lift the hips. So we're coming up into a supported bridge. So notice I'm not sort of overly extending through the hips. It's a minimal lift or a low bridge lift. So inhale as you lower. Exhale, squeeze the block, lift up through pelvic floor and hips. Squeeze the glutes. Good, inhale, lower. Exhale, that coordination of the bite of the block, lift of the pelvic floor, squeeze of the butt. Not asking much really. Good, inhale to lower. Keep the shoulder heads drawing back, chin to throat. Lift up as you exhale, squeeze and lift. Good. Hopefully that's becoming sort of automatic now. Inhale, exhale to lift. Now I really want you to hold at the top now and do some gentle pulses in towards the block. And as you do that, I want you to have a sense that you're dragging your hands back on the mat. So we start to get our lats involved here too. Good, for 5, 4, 3, 2, 1, and lower down. Good, and then realign the shoulders, retract them into their back pockets. Take an inhale. Exhale, gently squeeze the block. Lift up through pelvic floor, hug of baby to spine. And coming up, and then gentle squeeze, squeeze, squeeze on the block. Beautiful. For 10, 9, keep drawing the shoulder heads back and that pull back of your hands on the mat. So you'll have to actively broaden across the front of the collarbones as you squeeze the shoulders back and pull the hands back. Keep squeezing the inner thighs for 5, 4, 3, 2, and 1. Awesome. Coming back down. Now, sort of if you're a pretty beginner in terms of glute and core work, maybe just hold off on the band for now. If you're a sort of established glute and pelvic strengthener, then grab your booty band, place it around your shins. Now I like to squeeze my heels together, and then the knees are slightly forwards. I'd probably say they're in about like a 45-degree angle. So squeeze the heels together, left or supporting shoulder draws back into its back pocket. I'm going to lift up through the pelvis here. So it might be enough you just to gently rotate the knee up towards the ceiling. Pelvis stays even. We're not turning the hips open, we're just turning the knee open slightly. And then to maybe kick that leg gently long. So if you're in that sort of more beginner category, or you've got any sensation to the pelvis doing that, take your band off. It's just a gentle open and then a kick, and then the knees come gently back together. Good, so this lift up through this frontal body, lift up through the knee, extend it, heels together, thigh down. Good for 5, for 4, for 3, for 2, and 1. Come back down. Whew. Have a little breather, shimmy and roll. And then if you didn't put the band on, I'd like you to put it on for this one, and this time just move it up a little higher above your, just above the knees, that's on the distal thigh. And then we're coming into that sort of supine or semi-recumbent bridge position again. Shoulder heads roll back, take an inhale. As you exhale, lift up through the hips. Go take your left leg a little closer in towards the midline, and then you're just going to take some little pulses, drawing the thigh up against the band. Now, my belly is going to retract, as is my pelvic floor going to lift as I do that gentle knee hip flexion. So I feel all of those deep muscles engage. For 3, for 2, for 1, feet down, come back down. Again, if that's too much or there's any sensation through the pubis, the pelvic joints, then just take the band off and you can do it without, or you can stick to just the reverse bridge, 2 feet down. Come up on an exhale, right leg's gonna take its way just a little more gently into the center. Really squeeze that right leg glute to support you. And as you exhale, draw that knee in towards the body, hug of baby to spine, lift of pelvic floor. Good. For 5, for 4, for 3, for 2, and 1. Whew, come back down. You're like, I thought you said this was yoga. It's our strengthening before we do some opening. Good. Come onto your side, actually opposite side. In all the years I have been doing fitness and physio, I still get my lefts and rights confused on a daily basis. Shoulder head draws back. Oh, sorry. Shoulder head draws back. Lift up through the hips, heels together. It's a little lift of my top knee and then a kick of my leg. Again, if you're getting any sensation through the pubis, take that band off. Realign yourself. So my knees are just forwards of my hips, so they're about a 40-degree flexion. Good, open up. You should feel the underside hip is working quite hard, and then you'll externally rotate and then abduct a little. You get the rotators and the abductors of the hip working there on that top leg. Good, shoulder heads draw back, chin is neutral. Lift up and engage through the belly. Good, 5, for 4, for 3, smile if you can, for 2, and 1, come back down. Goodness me. All right, we'll come into one of my favorite little moves of the day. We're going to be in sort of like a cat position, but cross the right ankle over the left thigh and just come into a couple rounds of cat-cow here. Now, pregnancy cat-cow, instead of coming into that sort of super arched spine in the lumbar, we inhale to come to neutral, we exhale to round. I don't mind how much you round into the upper back and tuck the chin in, and there's a hug of baby lifting up away from the floor. And then it's an inhale to neutral. Rather than dumping into your lumbar spine, just squeeze your shoulder heads back and let your chest shine forward. So notice there's not any lumbar extension, just a thoracic extension. Inhale to neutral, exhale to round. We'll come back through center, and then left hand's gonna reach over towards that right side as I wag my left tail back towards the right. Again, I'm still hugging that sense of hugging baby up and away from the floor, hug of bump baby to spine. And that will give me more of a sense of opening in through this lat and underside body. Good, come back to center, unhook the legs, rehook in the opposite direction, right ankle over left thigh. Inhale is neutral, exhale, hug of baby, lift of pelvic floor as you round into the upper back. Inhale, neutral, exhale, again, hug baby to spine. Shoulder heads draw back, but heart lifts forwards. Good, inhale, neutral, exhale, round. Good, inhale, center. Exhale, lift for the last time. Back to neutral, and then right hand, or both hands over to the right side. Right tail is gonna wag back towards the left. Nice, beautiful sort of QL, lat stretch, bit of everything. We'll come back to the center. We'll take the right leg forwards and come into our sort of psoas and QL release. So really lifting up through the front of that thigh, hug the legs towards each other. So it's an active lunge. We're pulling the back thigh forwards, squeezing the right heel back, lifting up through the belly. That's phase 1. Phase 2 is to lift your back hand, that left hand up, and come into a lateral stretch. Again, really conscious to lift up and in, to keep the top, the bottom of your rib cage rather hugging down, but that pubis lifting, that sort of sense of bump lifting. Good, and then take your hand behind your head a little. Keep everything engaged and keep flexing towards the right, but then see if you can just almost like lift your chest up and your head into that hand, so you're taking a little bit of upper back extension into it. Really strong, keep squeezing the legs. Good, and then from here release. We'll take that left leg parallel to the short edge of your mat, come into a QL release. So again, these look like stretches, they are stretches, but we're active particularly through the glutes so that we can release the anterior or the front body. Good. Lift up, up, up through here, and then even let your neck sort of relax a little. Beautiful. Then from there, I'll take the left hand down, left leg is supporting, and come into a lateral stretch in the opposite direction. It's really nice here as well to add in a little psoas resist or hip resist. So inhale to stretch, exhale, little gentle push-pull of your hand. Good, inhale here, exhale, push-pull. Good, feel the deep tummy and the hip flexors engage. Good, and then slowly windmill yourself back up. We'll take that back foot, position it into a warrior 2. You might need your block just to sort of help yourself assemble, and then we'll bring that block up and we're going to place it onto that front thigh. My forearm is going to be on that front thigh as well. Any pubic discomfort, you might bring your legs really close together. Or stick more to like a lunge position if that's feeling too much. Now in this position, I'm going to assemble myself into my warrior shape. I am squeezing the glutes, drawing the heels towards each other and lifting up through the front body. And then I'm going to give a little tug of this thigh, front thigh, up into the block so you feel the hip flexors engage. Good, and then we'll just gently reach up. And lots of deep tummy, deep psoas work today to help support the lumbar spine. Good, and then take your hand under your bump, and maybe, especially if you've got a nice light block, you can reach it up and over back. Again, forearm on the block, medium edge, pull up, up, up into the block, and reach up, up, up and over. Good. One more, reverse. Pull, pull, pull. And then we'll come into a goddess squat. Nice little sways side to side, just releasing in through the groin tissue. Keep the low back long. Beautiful for 5, for 4, for 3. So nice on the legs. Do you like that kind of thing? All right, grab your block, take it with you, come down, right leg is down now. Come into our lunge on the other side. Frontal hip lift, lift up through the psoas, squeeze the left leg back towards the right. Right arm is going to reach up, and then we'll come into that sort of lateral flexion. So lots of squeezing into this right glute. It's going to make the front of this hip and this sort of psoas rec fem feel safe to open up. Good. Lifting up through your belly, maybe taking that top hand behind your head, kind of retracting into it gently. Good, and then if that's enough, you definitely can stay there. That's pretty strong. Or maybe starting to gently press your sort of head back into your hand a little more and lifting up through the sternum more as you look a little to the left. There's a tiny upper back extension really. All right, release that. Right shin parallels the short edge of your mat. Come into our beautiful QL release here. Again, I'm never just sort of lax and lazy in my stretches. There's a real sense of active glutes, active lift up and in. Beautiful. And then from there, I'm going to take my right hand down, come into our nice sort of side support here. Good, squeezing the glutes, pressing the hips forwards. And then maybe we're coming into this sort of active hip flexion. Inhale to stretch, exhale to press. Good, inhale, exhale. exhale, getting those deep muscles working so we can release the low back. Good. Last one, inhale, strong glutes. Good, stretch, come up, and then we'll come into a warrior two. This time left leg is forwards. I'm going to take that block on the medium edge. Again, shorten your stance if you need to. Okay, we don't want to feel any adverse sensation in through the pubis or the sacroiliac. Inner heel line squeezes together up into that sort of adductor line. And I'm pulling that front thigh up, up, up into the block. Good. And then inhale to reverse. If the block was too heavy, hold it down with the other hand, or you can take it up and over. Come into your supported two. Push or pull rather with that top thigh up into the block. Belly is lifting, glutes are hugging. Good, inhale to reverse. Exhale. Good, last time, inhale to reverse. And exhale, pop that down. Come into your sort of goddess position. Some nice little releases side to side. Bit of opera voice there. Always fun. For 5, for 4, for 3, for 2, and 1. All right, coming down however you may. Finish off with some glute openings. It's a short, sweet little class today. Crossing ankle to thigh. Again, make as much space for your belly as you need to. This bottom leg can sort of give you more space by taking it further away. Earlier on in pregnancy, you should be fine. A lot closer, no belly compression. You'll hear me talk a lot about this gentle rocking effect. I love it, especially as busy mums. Nice way to calm the nervous system. Good. And then just take that down and just let the legs sort of rock over, internal, external, internal, external, just giving the hips a little bit of mobility. Again, you might not get as far as I am. I don't have a big baby bump. So, good. And then switching sides, right onto left. Again, close or far away from the body. You choose based on your bump size and how comfortable you feel. Flex at the ankle, get that nice protection and strength in the ankle and knee. Little gentle rock, rock, rock. And again, my shoulders are just drawing back and constantly reminding myself of those sort of postural elements. So nice to release that sort of lateral edge. And then gentle, gentle, internal, external. You might find you creep forwards a little as you do it. Just kind of roll with it. Good. And then coming back into a cross-legged seat. It's nice to sort of elevate the seat onto your bolster or your block to help the spine stay nice and tall. And then coming into our pelvic floor releases. Take a few deep breaths. When our glutes are strong and we don't have pain in our spine, our pelvic floor can work and function more optimally. And sometimes when the glutes are weak and the core is weak, the pelvic floor is working really hard all the time, and then when we ask it to work harder, when we lift something heavy or we cough or we sneeze or we jump or whatever, you know, the pelvic floor is already like it's fatigued and it can't do its job to sort of keep you continent. So just, you know, the glutes and the core, pelvic floor, really, really synergistic, and we need to work them all equally. Soften the shoulders, soften the jaw, soften the neck. Take a big sigh out if you need to. Take an inhale. As you exhale, gather the pelvic floor at the back, the pelvic floor at the front, lift up and in, and then inhale to release that. And particularly if you're sitting on a block, or you might even sort of straddle bolster Japanese style, You get that sensation of like feeling the pelvic floor like get heavier and drop onto the surface beneath it. So, you know, that tactile, that sensory can really help you if you feel like you struggle with the sensation of letting it go. Even a sort of big rolled up towel and sort of straddling over that, kneeling, you'll be able to feel a sense of like letting the pelvic floor go onto that. Sense of like buttery melting, the lotus flower opening, unclenching of your butt and your jaw. It takes some practice. We do it at the end of every class because it's a skill, especially, you know, as many women have an overactive pelvic floor, as do a weak pelvic floor, and quite often they coexist. You can have a weak pelvic floor, but it can also be overactive. Two more breaths, softening, softening. And hopefully your spine's feeling a little more limber. Nice short and sweet practice today. I hope you enjoyed that, and we'll see you again on the mat soon. Namaste.